This topic needs a few minutes to cover properly, so this video is a bit longer than the others. It's important for anyone considering this strategy to understand how it works. Reference-based pricing, sometimes called metric-based pricing or claims repricing, is the most productive strategy when it comes to lowering health plan costs. It's also the least understood and the most challenging strategy. What I'd ask you to remember is that on the continuum of strategies we have available to grab control of claim costs, reference-based pricing is on the most aggressive end of the scale, and it doesn't have to be part of any program. Okay, the defining feature of reference-based pricing is that language is inserted into the health plan document itself to define exactly how certain claims are paid. A known figure is referenced in this language, generally either Medicare reimbursement rates or a facility's cost to provide a specific service, which is reported to Medicare once a year. For example, the health plan might specify that it pays facility charges the higher of 120% of Medicare or 112% of the hospital's actual costs. This amount is almost always quite a bit lower than the reimbursements hospitals receive from the major health insurance companies. Let's take a look at an example. A patient has a CT scan at a hospital outpatient facility. When that claim comes in, the plan administrator communicates to the hospital that the health plan pays based on the language in the plan and offers that amount to settle the charges. A surprisingly large percentage, roughly 85% of facilities accept the amount offered. An additional 10% of the claims are settled through negotiation, but of course that leaves 5% of these claims that can become a problem. Let me take a moment to bring this into further focus. Keep in mind that 3% of claims drive 70% of the claim dollars. So this process is only used in a small number of claims, those being facility claims. The day-to-day claims from physicians, labs, and so forth, they're usually not challenged or negotiated. They're paid as usual. So less than 1% of all claims end up creating friction or noise. And that's what worries execs and HR managers. What generally happens is that the patient is balanced billed by the facility. And that can be problematic because the bill could be quite large. In our example of a CT scan, the balance bill to the patient might be several $1,000s. The problem is magnified if the patient sits on the balance bill and the charge ends up going to collections. So, two things. First of all, we try very hard to head off issues with employees getting upset or alarmed when they get a balance bill or a collection notice by educating them about what to do when that happens. This part is really critically important. Employees have to know what to do when they get this kind of correspondence. Second, it's important for the employees to know that when they send any balance bills or collection notices in, they will not be responsible for any amounts other than copays or deductibles they would have had to pay anyway. In the case of collections, a letter is sent immediately to the collection agent from a law firm, which bars the collection agency from contacting the employee again. The possibility that employees might be in this situation is what people refer to as noise or friction with reference-based pricing plans. Experience has shown that, for the most part, employees who know what to do and who understand that their costs for health insurance will continue to eat up all of their wage increases without these measures, and who have an advocate to support them throughout the process, are very satisfied with the program. It all comes down to proactive communication. One last comment. I've described the most aggressive form of reference-based pricing, the one that yields the greatest savings. Softer approaches can be taken. For instance, negotiating all charges with facilities before or after an episode of care, which will greatly reduce the number of balance bills and collection notices. This approach, though, will mean less savings. The question is, how much noise or friction is acceptable to get to the savings goal?